I'm Dr. Joanette. I'm an ER doctor and a longevity specialist. And in today's video, we are going to take a look at a question that I get all the time from both my patients and my clients. Which magnesium supplement should I be taking? So if you've ever stood in that supplement aisle and wondered which magnesium, citrate, glycinate, oxide, L-threonate, what does all of that even mean? Then you are in the right place. Because today I am going to break it all down for you. What each magnesium type does, which forms are actually worth your money, and how to pick the right one for your body and your goals. I'll also show you what I personally recommend based on both the science as well as real world results. So let's jump in. But before we get started, I do want to remind you, even though I am a board certified physician, I am not your physician. This video is meant for educational purposes, and before you make any dietary or supplement changes, do it in conjunction with your personal physician because they know your history best and they know what will work best for you. So let's get started. First, a little context. Not all magnesium is created equal. Magnesium supplements come in two broad categories. There are the organic forms like citrate, malate, glycinate, and threonate. And then there are the inorganic forms like oxide, sulfate, and chloride. So what's the difference? Your organic forms tend to be better absorbed by your body and are usually easier on your stomach, whereas your inorganic forms are generally less expensive, but not always well tolerated. These are the forms that we often use in the hospital or for acute interventions, not your daily wellness supplements. So let's walk through what the most common forms are, what they're good for, and what I want you to watch out for. Here are some of the common magnesium types. Number one is magnesium citrate. This is one of the most popular, and for good reason. Why? Because it's well absorbed and often used for just general supplementation. It has also been studied at a dose of about 500 to 600 milligrams per day for migraine prevention, and those studies show good results. Is there a downside? Yes. It can cause loose stools, especially when you're taking it at higher doses. So if you have a sensitive gut, proceed with caution when taking this one. Next one is magnesium malate, one of my personal favorites, and it provides good sustained blood levels of magnesium, which means you get more stable support throughout the day. There was a clinical study that was done and it looked at red blood cell magnesium. It increased the red blood cell magnesium by 60%. And people who were experiencing symptoms, the improvement of those symptoms hit 63%. This is a great option if you want some long-term, well-tolerated forms of magnesium. A quick side here, when you get your magnesium level measured, you want to measure red blood cell magnesium levels, as the vast majority of all of your total body magnesium is within the cells, and your red blood cell magnesium is a great way to really get a more accurate measurement of what your total body magnesium is versus your serum magnesium levels. Most tests get serum magnesium levels, but ask for a red blood cell magnesium level. Next up is magnesium glycinate. It's also called bisglycinate. It is your go-to for stress, anxiety, and difficulty sleeping. It's very gentle on your gut, and if other forms upset your stomach, this one likely won't. There's been some studies suggest that it may not raise your blood magnesium level quite as much as some of your other forms, but it's excellent for people who are magnesium sensitive or who want to support their nervous system. Next up, magnesium oxide. This is the one you will see in most of your low-cost multivitamins. It's cheap, it's easy to produce, and unfortunately it does have a side effect. It's very poorly absorbed, only around 4%, but it was still used in some migraine studies at some higher doses. That said, I rarely recommend it because there are just simply better options that have fewer side effects. Next, magnesium chloride. This one sits right in the middle of the spectrum. It's not as well absorbed as malate or glycinate, but it is better absorbed than oxide. It's used in some marine-derived magnesium blends like Aquamin Mag, which performs a bit better than just plain magnesium chloride. Now let's talk about a couple of lesser known forms of magnesium that are worth knowing about. Two forms that you may have heard of, but probably don't know very much about. They are magnesium sulfate and magnesium L-threonate. Magnesium sulfate, this is what's in Epsom salts. Great for soaking those muscles, but when you take it orally, it is a strong laxative and it has very poor absorption. I mainly use it in the hospital for things like seizures or as an IV magnesium source. Bottom line, unless your doctor specifically prescribes it, magnesium sulfate is not the best form for your daily use. Next one, magnesium L-threonate, another lesser known magnesium. This is one of the newer and what I think more exciting forms of magnesium. It was specifically designed to cross the blood-brain barrier, which means that it can actually reach your brain tissue. It's being studied for cognitive function, memory, mental clarity, and even age-related cognitive decline. There's been some early human trials that have been showing some really promising results. It's exciting, and these trials have been promising, especially in older adults. Is there a downside? It doesn't provide a high dose of elemental magnesium, and it's also a bit on the pricey side. But if you're focused on your brain health, this is a very targeted and what I believe smart option. Two more magnesiums. These are newer advanced formulations. Let's talk about some of the innovation that's happening in the supplemental science that are worth knowing about. They are sucrosymal magnesium. This uses a special delivery system that boosts absorption significantly and reduces gut-related side effects. There was a head-to-head study. It outperformed both magnesium oxide and magnesium citrate. With magnesium bisglycinate, both blood and red blood cell magnesium levels improved more than with the sucrosymal forms. The next one is MagShape microencapsulated magnesium. This magnesium is in microencapsulated magnesium that is slowly released over 6 hours. What this means is that you get smoother absorption, longer support, and fewer GI side effects. For people who can't tolerate standard magnesium, this one is amazing. Also worth noting, though, is seawater-derived magnesium, like magnesium hydroxide and citrate from seawater do show better absorption and also a higher elemental magnesium content. What this means is that you can take a smaller dose and still get good results. Here's a quick check-in. If you're finding this breakdown is helpful, now is a great time to hit that like button, subscribe to help this video reach more people who are searching for these answers. It also lets me know that you want more of these science-backed health guidance tips like this. All right, let's get back to the good stuff. Let's quickly run through what is best for common health goals. For your migraines, take magnesium citrate, magnesium malate, or even magnesium oxide. The dose should be 500 to 600 milligrams a day. This has been shown to reduce migraine frequency. And if you want a brain-targeted form, then take acetyl taurate. It may offer some additional benefits, but the human studies are limited. If you have anxiety or mood disorders, then magnesium glycinate is my top choice. It's also easy on digestion. Acetyl taurate also shows promise for nervous system support. If you're looking for improved memory, improved focus, and reduced brain fog, this is where magnesium L-threonate is important. It is the only form shown to reach the brain and support your cognitive performance. If you have muscle cramps, the evidence is mixed. It might help with pregnancy-related cramps, but it doesn't seem to make a big difference for what I call idiopathic leg cramps, especially in the older adult population. For your heart health, magnesium does have some benefits, but there was a 24-week trial that looked at magnesium citrate, sulfide, and oxide, and that trial did not show any major effect on the blood pressure or the arterial stiffness. So for heart-specific goals, the evidence here is unfortunately underwhelming. If you have a sensitive gut, magnesium glycinate, MagShape, and sucrosymal forms are your best bet. They all have minimal GI side effects and are also still effective. The most common side effects of magnesium supplements are diarrhea. That is why tolerability matters. Some of the new forms like your MagShape and your sucrosimol are making a big difference here. As for safety, magnesium is generally well tolerated. But remember, toxicity can happen at extremely high doses. If you're dosing yourself over 5,000 milligrams a day, especially if you have kidney issues, you may have a toxic magnesium level. As always, talk to your doctor if you're on medication or have any pre-existing conditions before you start any magnesium supplementation. So, what is the best magnesium supplement? Bottom line, here is my quick clinical rundown. Migraines, go with citrate, malate, or acetyltaurate. Anxiety and mood, choose glycinate or acetyltaurate. Brain health, choose L-threonate. Sensitive stomach, choose MagShape, sucrosimol, or glycinate. And for long-term magnesium supplement, malate is an excellent choice. Avoid magnesium sulfate unless it is specifically medically prescribed, and also skip magnesium oxide unless it is your only option. I hope this video helped you make sense of all those magnesium supplements and also gave you some clarity to choose which one is right for you. If it did, please take a second to like this video and subscribe to my channel. Also, thank you for sharing it with someone who has been confused about magnesium supplements. If you would like to learn more, head over to my website, growwithdrjoanette.com. Thank you for watching. Stay sharp, stay strong. I'll see you in the next video.